Instruments needed to take blood pressure are a blood pressure cuff, blood pressure meter, and a stethoscope. When taking a blood pressure reading from a patient, it is important that the patient is comfortable, sitting upright, and their feet are flat on the ground for an accurate reading. To begin, identify the artery mark on the blood pressure cuff, locate the patient's brachial artery, and wrap the cuff around the patient's upper arm, close to the heart, firmly. Ensure the stethoscope prongs are facing outward in your ears in order to hear the sounds clearly. Locate the patient's brachial artery and place the stethoscope chest piece below the cuff, flat on the artery. Quickly inflate the cuff pressure to 200 millimeters of mercury. Once the cuff pressure reaches 200 millimeters of mercury, slowly release the pressure, turning the knob to the left at a rate equal to 2 to 5 millimeters of mercury. Next, listen to carotid cuff sounds, which are separated into 5 different phases. The first phase being the systolic blood pressure reading, which is the highest pressure during contraction of the heart. This is the initial sound or the onset of sound heard. The fifth phase is the silence or complete disappearance of sound, which represents the diastolic blood pressure reading. The diastolic blood pressure is the pressure in the arteries between heartbeats when the heart muscles are resting and refilling with blood. The blood pressure reading for this client was 112 over 72 millimeters of mercury, which is considered normal. For your reference, the normative values are represented in this table.